Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, August 30th, 2022. And our top story today, common dental hygiene habits a dentist would never do. Well, joining me now to discuss this and a lot more, Jamie Dudley is with Flossing Dental Care. Jamie, good to see you again. Thanks so much for joining us on the program this morning.
Thanks for having me. Good to see you too.
All right, dental health, dental care, oral care, however you want to define it. Before we get into, this is really kind of a no list, but I don't know, the way we kind of phrased it is more like these are things your dentist or your dental hygienist wouldn't do. But let's just reaffirm the importance of oral health and why it's important for people, regardless of age, to maintain proper oral health.
Sure. Yes, absolutely. That is the bottom line, is maintaining good oral health. And the reasons you want to consider doing that is to make sure that not only your mouth is healthy, but your whole body is healthy. And by reducing and trying to eliminate as much of the plaque buildup that is primarily composed of bacteria, if we can remove as much of that as possible in the surfaces that it accrues, we're going to be much happier and healthier. So that's the bottom line. How we do that is a whole different story. Your toothbrushing, your flossing, but having a healthy mouth, meaning no inflammation, no gingivitis, no gum disease, is the goal to help you to do that.
Yep, and you have demonstrated. You've been very kind to demonstrate both on your teeth and some example teeth on how to floss and brush, and hopefully we'll get to that again a little bit later on. But let's talk about one thing that your dentist will never do, or even your dental hygienist in your case, and that's let stress impact your dental hygiene. And so many of us are under stress. In fact, I don't know a person of any age who's not under some level of stress. But this stress can mean clenching of jaws. It can mean grinding of teeth at night. And it could also mean just, hey, I don't have time for oral health care.
Yes, a lot of people don't realize how much stress can actually impact our mouth health, our temporomandibular joint health. And a lot of the ways that we do take our stress out is by clenching our teeth, our jaws together. And over time, that can actually be a big problem. It can cause our teeth to break down, which can make it easier for caries or decay to happen. It's not comfortable, and it can just make the overall alignment of our teeth and functioning not good in the long run.
Yeah. And that stress, Jamie, we feel it in so many ways. Some days I wake up and my jaw is tired, and I talk for a living. Part of my living is talking. But if I'm stressed here, gosh knows what that does to the other parts of my body. My shoulders, my arms, my chest, everything. It just feels like it starts with that grinding and as you say, the temporal how do you say it?
Temporomandibular joint. So
exactly. She went to medical school. I did not.
Yes, absolutely. So with that, Jeff, it's a good idea to discuss things like a occlusal guard or mouth guard that can help protect your teeth by providing a barrier between them, especially at nighttime when most of us do things like clenching or grinding our teeth. But yes, stress manifests itself in a lot of funny ways, and being able to see that in your oral health can help, again, for the overall health too.
Yeah. And I think that you probably see a lot of the results of that as you're dealing with people of all ages. Here's another one, Jamie. Using homemade do-it-yourself whitening methods. And according to an article I read, hydrogen peroxide is in a lot of these products, but the hydrogen peroxide, which might be good for other parts of the body, not necessarily good for your mouth.
Right. And I think the home DIY home whitening yourself can be a little tricky. You do not want to necessarily go in and jump on the first recipe you see online, because hydrogen peroxide can be very damaging when it's used inside the mouth. It's considered an oxygenating agent, which can be cancerous, can change cells quickly. So that's why it's really important to use something that is by a brand manufacturer, or talking to your dentist about the products that they have. That is the takeaway key, is not using certain chemicals that are not processed to be used as anything other than mouth whitening, or helping with, there are some rinses that you can use to help for healing purposes. So yeah, not a good idea.
Yeah, definitely not a good idea. And probably something, as you said, you want to talk to your practitioner, because they know what will not wear down your enamel. And as you said, put your, I was going to say feet, but put your shoes, put your teeth at risk. Jamie, I want to take a very quick break. When we come back, we'll talk more about some do's and don'ts for proper oral hygiene. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you over 50? Would you like to get up to 33% more income in retirement? Then call now for this free book, Annuity Do's and Don'ts for Baby Boomers. This free book reveals little-known secrets about annuity strategies that will help you make the right choices before buying an annuity. Call right now for your free book, and as a bonus, we'll also throw in a free annuity rate report, both absolutely free, for calling Annuity General today.
Call 800-504-8194.
Welcome back. We're talking this morning to Jamie Dudley of Towson Dental Care. Jamie, thanks so much for sticking around with us this morning.
Yes, absolutely.
And I was joking, but it is true. You help guide people through proper dental care each and every day. So it's great that you could spend a couple minutes with us. Here's one that I know you're going to pick up on. Don't brush too hard, and don't do it not enough. You've got to be consistent, but also you're not sitting there scrubbing like you're scrubbing the wheels of a car.
Yes, this is really important. Using a soft bristle toothbrush, I cannot emphasize the importance of that. Using anything more than extra soft or soft bristles can really actually do a lot of damage to the enamel and the gum tissues. It it doesn't take a lot to start to thin the enamel, which is the outer coating of our teeth. And once we lose that, unfortunately, it doesn't regenerate on its own. So using a soft bristle toothbrush helps us to be able to control some of that. But in that same token, you do need enough pressure. It is recommended to use an electric toothbrush, which also I do now encourage my patients to make sure the toothbrush bristles on electric stay soft too, because I'm seeing that they sometimes sell medium bristles. So yes, just doing enough, but not too much, and being too aggressive, so we can maintain a healthy balance of the tissues and especially the enamel surrounding our teeth.
Yeah, and you bring up the point of the gums. That's really important because you don't want to have recession or rescission, I guess it is. Recession is maybe what we're in. But rescission, gum rescission, not good. Taking care of those, you don't need to scrub them so they bleed. Here's another one, Jamie. Forgetting the floss. I mean, a dental hygienist or practitioner, they would not forget to floss their teeth with even simple dental floss.
Yes, another very important component to daily oral health. Without flossing on a regular basis, you should be flossing every day, once, twice a day, depending on what you're eating. We're leaving, up to half of the buildup that we can accrue in our mouth there. And a lot of people are not aware of that. So it is important to get tools like floss in between and under the gum lines to help remove that plaque, which is essentially a lot of bacteria, a way to keep the gum tissues in the teeth healthy. It is better if you can use the string floss. And also some people do have challenges flossing, which is really important. So look at water flossers, water picks. They will help do very similar outcome. They help to flush out to do the same thing, essentially. I like to use both, but at least using one of those would be essential for your routine care.
Yep, and keeping that food from laying in your teeth, and also could potentially infect your gums. So I understand. I think I've actually experienced that. Here's the last one, Jamie. Most dentists and dental practitioners would not participate in dangerous TikTok and social media trends. And look, I'm not a big TikToker, but occasionally you see that stuff kind of float in the media. Not really a good idea to do the hydrogen peroxide challenge or the don't brush your teeth for 5 days challenge.
Yes, they kind of makes me feel like nails on the chalkboard when I see these things occasionally. I've even seen the one with the magic eraser cleaning scrub, and it is a home cleaning sponge that is to help remove stain. And there was a challenge at one time, or people were showing themselves doing that, and that is really dangerous actually for the health of the teeth. It can, not only are you putting dangerous chemicals in your mouth, you are removing the layers of the enamel again, and you're just putting your teeth in harm's way essentially. So definitely do not feed into any of those, because they can be very harmful.
Yeah, I mean, it might be fun to hang out with your peers and do different things, but Jamie, it's always important to know the source, right? So if that person doing it or originating it is a dentist or a dental hygienist or a practitioner or someone from the medical field, maybe have a little bit more comfort. But really, if it's something outrageous like the hydrogen peroxide mouthwash challenge, I'm just making it up, I don't know if it exists, probably does, then you need to make sure, check with your practitioner before you do that, right? I mean, it's just common sense stuff, and it seems cool, but tap out. No, don't really need to do that.
Yeah, absolutely. Always revert to talking to your healthcare provider, to your dentist, your hygienist. Usually we can help steer you in the right direction.
Yeah, well, certainly in a better direction than the hydrogen peroxide challenge. Jamie Dudley, always great to see you. Thanks so much for joining us. You have great teeth, by the way, and we look forward to having you back on the program again very soon.
Thanks, Jeff. It was great being here.
That wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to, drop us a line. And don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content, we'll visit our website and, of course, our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
But if you're tired of the same
Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.